In general, manage diabetes mellitus dose in an ideal way. Diabetes mellitus needs, or diabetes mellitus type 1, they will need basal insulin all the time, okay? In general, what is a common side effect of calcium channel blockers? Peripheral edema. So even amlodipine will have the side effect of peripheral edema. With regards to studies, what does blinding help prevent? Observer bias. Blinding helps prevent observer bias. What is one of the most common pathogens isolated from cultures of corneal foreign bodies, along with strep, Haemophilus, and Pseudomonas? It would be Staphylococcus, right? If you have a patient and they have a positive straight leg test at 60 degrees or less, what does it indicate? Nerve root irritation. What medication is used to treat rhino-orbital cerebral mucormycosis? Liposomal amphotericin B is used to treat rhino-orbital cerebral mucormycosis. What is a complication of infective endocarditis? Mycotic aneurysm is a common complication of infective endocarditis. Note that bowel ischemia and incarceration are potential complications of inguinal hernias. If you have a patient that has unstable angina and non-ST elevation myocardial infarction, what sort of test should you order? You should order an exercise stress test. Proteinuria in a diabetic patient can be slowed by what? By tight control of their diabetes, right? If you manage the diabetes, their proteinuria and kidney function should, improve or not be worsened at an increased rate. When you're dealing with patients, try not to challenge their beliefs for the most part. You know, what sort of strictures are common complications of healing from GERD? Peptic and esophageal strictures are common complications of healing from GERD. What sort of inflammation of an organ is associated with splenic vein thrombosis? Pancreatitis is associated with splenic vein thrombosis. The corrected calcium in in milligrams per deciliter is equal to the measured total calcium plus 0.8 times, open parentheses, 4.0 minus the serum albumin. That's the corrected calcium, because calcium binds to albumin, serum albumin. Note that presbycusis is really obvious when a patient is under the effects of a lot of background noise. So like at a party or some sort of social gathering, that's when they really show signs of presbycusis. So sometimes scoliosis is benign, but if your patient's having back pain, that can be a clear indication that the scoliosis is causing pathological issues. If you have a patient with pneumonia that has a history of foreign body aspiration, cough, sputum, and fevers, and things like that, what should be on your differential? Aspiration pneumonia should be on the first, second, and third for your differential. If you see muddy brown casts on a UA, what is most likely happening with regards to the kidney? Acute tubular necrosis, right? Those muddy brown casts are synonymous for acute tubular necrosis for the most part. And if the patient is oliguric and anuric, or one of those, you should discontinue the IV saline. Patients with concern of aspiration need swallow studies, by the way. How can you increase the power of a study? By increasing the number of study participants. That's how you increase the power of a study. If you are outside in the sun, what sort of sunscreen should you use? 30. 30. Use sunscreen with an SPF of 30, just in general. If your patient has a concern for peripheral artery disease, what should you measure? Their ankle to brachial index, right? Note that patients with SIADH may need IV hypertonic saline. If they are hyponatremic, give them 3% for severe hypernatremia, and fluid restriction with or without salt tablets. Note that genu valgum is knock-knees and is physiologic in the age range of like 2 to 5, right? So it's not a big deal. True or false? Hyperthyroidism can cause osteoporosis. That is true. Exceptions from parent/guardian consent for a child is fine under emergency situations like life-threatening things, STI treatment, or for emancipated minors. So in those settings, you don't need a consent from a parent or guardian to treat the kid. If your patient comes in and you suspect that they have dyspepsia, what sort of testing should you do? H. pylori stool testing, right? In general, what medication increases the risk for endometrial hyperplasia? SERMs, selective estrogen receptor modulators, such as tamoxifen and raloxifene, increase the risk for endometrial hyperplasia. Females with low BMI are at risk for osteoporosis, FYI. And note that if you're talking to a researcher and they're like, hey, I'm trying to study some criminals in prison, do you think they're going to need less IRB approval and oversight, or maybe a little bit more IRB oversight and approval, right? It might require additional things because you're studying people in prison. Is it ethical? So how do you treat Lyme disease in an adult for the most part? Oral doxycycline to treat Lyme disease in an adult. What is the initial therapy for insomnia? Cognitive behavioral therapy is used to treat insomnia initially. If your patient's been coughing for over 4 weeks, what should you perform? A spirometry, right? Cough over 4 weeks indicates the need to perform spirometry. A patient that is peeing blood and they just got back from their trip to Egypt or Africa or something like that, what do they likely have? Urinary schistosomiasis, right? So you diagnose that with urine sediment microscopy. Note intramuscular betamethasone, which is a corticosteroid, is needed for premature children. And what is premature? Less than 37 weeks gestation. You know the difference between scoliosis, kyphosis, and lordosis. So which ones have like the pot belly look? That's lordosis. And which ones have the hunchback look? Kyphosis. We all know what scoliosis looks like, right? That S-shaped back for the most part, one way or the other. What do you use to diagnose gross hematuria? Cystoscopy, right? Note that other indications for cystoscopy could include microhematuria, recurrent UTI, obstructive symptoms, and abnormal injury after urine cytology. If your patient just got out of the OR, they were under anesthesia, beware that they could have post-operative hypoxemia because that's commonly seen as a residual effect of anesthesia. And if your pregnant patient has abruptio placenta, what sort of test should you use to see if there's like fetal maternal blood mixing? A Kleihauer-Betke test, right? Definitely.